Now, Positively Ernie with Ernie Anastas, a New York TV legend and radio host with great positive stories and interviews.
Thanks, Ernie. You're the best.
And now, here's Ernie.
Hi, everybody. Welcome back to the show. Nice to have you here. I love, having you enjoy good guests. And I got another good one for you today. When I was a kid growing up, I always remember my parents, my grandparents, they were always talking about health. And they would say, good health is most important. And, when you're 10, 11, 12, 13, 14, 15 years old, when you're a teenager, you don't really think about that. You don't think about health until later on in life. And you remember, your parents and your grandparents, what they said. I'm going to talk about health care and with someone who's the best of the best. I want you to meet Deborah Visconi. She's here right now. Deborah, say hi to everybody out there.
Hi, everybody. Great to be here with you, Ernie. Thank you for having me on your show.
Oh, nice to have you here. You got such a smiley face. Nice personality. We met, and you have to know something about Deborah. She is an award-winning person who has done so much with an amazing medical center. It's the Bergen New Bridge Medical Center in Paramus, New Jersey. And you have done an outstanding job as president and CEO. And you've turned things around in many ways. And we're talking about health care. And you know a lot about that. Let's just start with some of the really basics. Why is healthcare so important to us? Why is it so important?
Well, healthcare is the backbone of humans, right? You want to make sure that we are as healthy as we can be.
Yeah.
We are only as healthy as a community as our least healthy community member. And so we want people to have long, rich, with wellness lives.
Yes.
And that's why health is so important to our communities.
Do you think people are more conscious about that, more aware of being healthy? Sometimes people talk about, the diet, people are not eating right, people are not exercising, but there are other people who are doing that. Give us a little bit of an overview if people are really trying to take care of themselves.
I think there is a huge raised awareness around health and wellness and taking care of not just your body and your physical health, but your mental health and your emotional well-being.
Yeah.
It all is part of the wellness and health package. I think our societies, our communities are learning how to take better care of themselves through screenings, through linkages with their primary care providers, to making sure that they are as healthy as they can be. And diet is part of that, exercise is part of that, emotional well-being is part of all of the package of being a healthy individual.
And Deborah, you mentioned, mental health. Boy, that's so important. I mean, people realize, now more than ever, how much we really have to pay attention to our emotional stability and making sure that we take care of ourselves mentally and physically. Now, you have so many departments, okay? You've got so much going on there, and you specialize in so many different areas. People don't have any idea how huge your departments are. Bergen New Bridge Medical Center. You've got so many people working there and doing, I've been out there. And I'm so impressed by what you do. Tell us about some of the departments and how exciting this is to help people.
Sure. So Bergen New Bridge Medical Center, located in Paramus, New Jersey, is the largest hospital in the state of New Jersey. We have 1,070 beds under a 1 million square foot roof, and we sit on 62 acres of Bergen County property.
Wow.
And so we are a formidable entity, if you will, within the county and in the state of New Jersey.
Yep.
We provide all services from primary care, so we have primary care providers that are part of our family, mental health we talked a little bit about, behavioral health services, addiction services, all of our surgical specialties, so we have general surgeons, we have orthopedic surgeons, vascular surgeons, so
everything.
We have everything available within the walls of the hospital and outside of the walls of the hospital. We really have become a beacon of health and hope for our communities beyond the walls of the hospital, providing those services to anyone who needs us when and where they need us.
Deborah, I know you've got a great staff. Wonderful people. I mean, the administrative and the medical services and so forth, the people that are there. How do you feel, leading the charge here? And at the end of the day, to be able to walk away and say, look what this wonderful hospital, this medical center, look what we're doing for people on a day-to-day basis. That's got to make you feel good.
It's only one word, and that's pride.
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 Yeah.
And gratitude. Maybe there's 2 words. Pride and gratitude.
Pride and gratitude.
For the people, the team that provides these services. Healthcare delivery is hard. It's never ending. It's a 24-hour job.
Right.
And our team of extraordinary professionals are there every step of the way. You know, I am the chief executive officer, but I really am the chief engagement officer, engaging our communities, engaging our staff.
Yeah, connecting.
Absolutely. Giving them the support and resources that they need to deliver that extraordinary care.
Yeah, but overall in the field of healthcare, I mean, it's really overburdened. In many ways, you've got high costs. People are worried about paying their bills. There are insurance problems and so forth. Talk a little bit about that in terms of, you know, from your perspective, what's being done and what needs to be done to make it better.
So beyond just us providing quality care, we do believe we have a responsibility to identify and address what we call the social determinants of health.
Yeah.
And those are things like housing and transportation and education and food insecurity, and literacy, and making sure that we are walking in lockstep with our communities to provide those services and those resources and those partnerships. It's not just about what we do as Bergen New Bridge, but it's those partnerships we have in our communities with many of our community partners out there, and how we link our patients and our families to those resources.
Well, you know, I mean, you're doing an outstanding job.
Thank you.
And you know, when you start to look at the big picture, healthcare in general, a lot of people are not insured. A lot of people can't afford to pay their bills. Give us a little bit of an overview on that, how you see it from your perspective, okay? What's being done about it and what should be done about it?
So we are in that unique position that we are a safety net provider. So we take care of any individual that needs care regardless of their ability to pay or the type of insurance that they have or their immigration status. We care for everyone. We care for primarily vulnerable communities that need access to health care. Yeah. And I think that is a problem for our society. Like, I don't think people really understand the bigger picture. Like, if we don't provide care for these people, your mortality rate goes up, your disease rate goes up.
Sure.
You know, and that goes through that's a generational problem. It affects the children, right, as they're growing up through our community. So it is a big burden and a big issue for all of our communities and society. Yeah,
and you know, I always go back to children because that's the beginning of everything. And how can we help our children to understand a lot better why it's important for them to take care of themselves, to make sure that they do exercise, they do get the nutrition, they eat the right food, form the right habits, and also, because I keep going back to mental health, to make sure that our young children have a good attitude about life and relationships. Yeah. I know you really believe in that so much. Yeah,
well, listen, the children and our children's programs have been our priority, especially, you know, through the pandemic and now post-pandemic, because we know that the children are suffering, right? We want to make sure that we give the children the resources and the families, the resources, the education, the access, making health fun. You know, there is no health without mental health.
Yeah.
And being able to identify these communities, go reach out to them, work with our school districts. I talked about partnerships before, partnering with our school districts.
Yeah, tell me how that works out, because that's a very important arm of what we're talking about, working with the schools. How are you doing that?
So we open access to our programs right through the school districts. We let them know the types of programs we have available, whether it's a mental health program or, you know, our Center for Hope and Resiliency for our adolescents, our eating disorders programs, our substance use disorder programs, giving the schools and the parents access to those programs early on so that they know we're here, going out to the communities, not just having people come to the hospital, but going out to the communities and working with the schools and saying, what do you need? What can we help you with? What educational programs can we offer to the children so that they have access, and the families. Yeah. The families are a pivotal part of success.
And those programs are working out really well, aren't they?
Oh my gosh, we open a program and they're filled up immediately because people realize that, you know, their children need help. Yeah. And we are, you know, we're here to help. We're a stigma-free environment. We don't judge. Yeah. You know, mental health, addictions are equal to cancer and cardiac care in our mind. If you have a disease, you have a disease. So, you know, we're a stigma-free environment and we welcome everyone. and we treat everyone with respect and dignity.
It's such a huge job. I mean, I really applaud you on the work that you're doing, you and your amazing staff, and I've met so many of the people out there. You know, I do a lot of interviews, and many times when we're talking about mental health, I know you hear this because you deal with it all the time. People are saying, I'm just working too hard. I'm getting too stressed out. Life is stressful. Every time I turn around, there's something that I have to worry about. What do we do? What do we do to ease that pain? And it's a chronic situation for so many people who are looking for an answer. They're looking for an answer.
Well, we focus a lot, especially for our workforce. I mean, we focus a lot on work-life balance. We allow people to basically create their schedule that they feel comfortable with.
Yeah.
You know, to choose to work from home or to be able to come to the office if they want to. We have professionals that help our own staff, you know, through counseling and other types of programs. So we do, especially, you know, with what's been going on in our society, with all the stressors that are around people and, you know, people not being able to pay their bills and find food when they need it.
Yeah, tremendous stress.
So we're always out there, you know, always helping our employees achieve the best life that they can achieve. We reach out. I always tell my team, reach out and touch someone. See how we can help others, and what can we do to make things better for you.
Yeah, and it's that one-on-one.
Yeah,
it's that human touch, that human element. I know a lot of people talk about technology, that we're always on the telephones and, you know, artificial intelligence and so forth, but it always comes down to the basic, doesn't it? People talking to each other, reaching out, reaching out.
I'm a big believer in that. And there's a role for technology, and there are people that are better with technology, so a text message might be great. But there's nothing like reaching out and touching someone and having that face-to-face, that eye contact. I maintain an open-door policy in my administration, and it's literally an open-door policy. People can come and talk with me and bring me ideas or bring me concerns, and I'm there for anyone from, you know, the frontline staff to the management staff.
People, I have to tell you, because I've been there. And I've met the people, I've talked to them, and I've done a little research on my own. People love you, Deborah. No. They do, because you are unique. You are so committed and so dedicated with passion for what you do, and you believe in it. And it's obvious. I mean, just listening to you talk right now, I can feel the enthusiasm from just hearing you talk about all the wonderful things that are going on there. You're proud of everybody.
I am, and I love my staff. You know, we just recently had a program. We call it the CEO I Made a Difference program. Well, we recognize staff members that get mentioned by name on a patient experience survey or a letter.
Yeah,
we had close to 200 people in a 1 quarter that were mentioned by name by a family member or a patient. And then they come to the special ceremony, and we have pictures and chocolate fountains, and the people, the staff that come to me and want to hug me and thank me and take a picture with me, it's just the best moment. You
touches your heart,
it
doesn't
really
it?
does.
Yeah.
It really does. And to see everyone just so proud of the work that we do.
You have your purpose in life, that's for sure. One of the quotes that I use a lot, you know, don't strive for success, strive for significance. And that's what makes a difference. That's what makes you so special. Okay, one final thought. The future. What does the future look like? With your experience, I mean, are things going to improve? Are we going to have a better healthcare system? I know you're doing a great job. But in general, overall, in our country, what's the future look like? What do you see?
I think the future is very exciting. You know, there's always bumps and challenges along the way, but I think our use of technology, if we use it in the right way, smartly, deliberately, our ability to capitalize on human capital, like the people, you know, encourage them, grow them, nurture them, mentor them. So I think between the combination of technology, you know, we've advanced so far in medicine.
Yes, we have.
We all live longer.
Yeah.
So being able to cultivate that generation, right? The boomers.
Yeah.
Cultivate the boomers, you know, nurture the new people coming in, utilize technology and bring it all together. I think that we have an incredibly bright healthcare future in this country.
Good. I love hearing that. That leaves us up on a positive note.
Absolutely.
Deborah, you've been a delight to have here today. I mean, everybody has enjoyed you. People should know Deborah Visconi, President, CEO, Bergen New Bridge Medical Center in Paramus, New Jersey. Congratulations to you personally and also to your wonderful staff. And, you know, one of the best signs of a good leader is to recognize the people around you. And you always applaud them. And that's why we applaud you.
Well, thank you, Ernie. It's been a privilege to be on with you.
What a joy to be with you, okay? Congratulations to all you do.
Thank you.
Okay, and come back again?
I will.
You promise?
Yes.
In good health, right?
In good health.
Happiness.
And you too.
And me too. Okay, thanks so much. Thanks so much for joining us, everybody. Take care and have a wonderful day.